What did the biopsy tell you?
Wasn't definitive.
But the twitching should stop right about now.
Oh my God.
Could have just been a coincidence. Twitching just had to stop at start. Let's be sure. The IVIG vacuums her blood, neutralizes the stuff that's making her twitch. It's actually kind of cool. Wonder if I could make you dance.
Enough.
This is unbelievable. You did it. You fixed her.
No. All I did was prove that she has cancer. Who did her vaginal exam?
I did.
Did she have hair?
What are you getting at?
Right now, I'm getting at whether or not she had hair down there.
Not much.
She's manipulative, yet completely docile. Everybody tells us that outburst on the catwalk was out of character. She's never had a period.
You're thinking this is hormonal?
I'm thinking she's the ultimate woman. I need to schedule an MRI.
The twitching stopped.
Because we changed your medicine back to the real stuff. Stop talking.
You gave me fake medicine?
That's what I said, in the vain hope that you wouldn't feel the need to also say it. Stop talking.
Wilson already did an ultrasound. Said her ovaries were undersized.
The ultrasound would be the way to go if you were looking for ovarian cancer.
What are we looking for?
That.
Oh my God.
Looks like a tumor, doesn't it?
But those are...
Yep. We found a tumor.
She has cancer?
Technically, no.
So it's not cancer?
No, it's cancer. But he has cancer. On his left testicle.
I don't have testicles.
She's not a guy.
His DNA says you're wrong. Frogs and snails and puppy dog tails. You've got male pseudo-hermaphroditism. See, we all start out as girls, and then we're differentiated based on our genes. The ovaries develop into testes and drop. But in about 1 in 150,000 pregnancies, a fetus with an XY chromosome, a boy, develops into something else. Like you. Your testes never descended because you're immune to testosterone. You're pure estrogen. Which is why you get heightened female characteristics. Like clear skin, great breasts. The ultimate woman is a man. Nature's cruel, huh?
This is obviously a joke. This is impossible.
No, a joke would be me calling you a homo. See the difference? I'll schedule him for surgery.
No, you're wrong. I'm a girl. Look at me. How could you say I'm not a girl? See, they're all looking at me. I'm beautiful.
That anger, it's just the cancer talking. Put your clothes back on. I'm gonna cut your balls off. And then you'll be fine.
Brainstem's clean.
Nothing in the midbrain.
What's that? Frontal lobe, upper right quadrant.
I don't see anything.
Yeah. It's tiny, but I think it's a tumor. That size should be excisable. Why didn't we see it earlier? How
Oh,
could...
God. Axial view, there's another one. Bring up the next slice.
Orphan Annie and Oliver Twist slept in our hallways last night.
Are they sane?
They're children. They need a guardian.
Couldn't find a babysitter on account of not being able to make any phone calls, on account of not being able to breathe, on account of his lungs filling up with serratia. He has chronic granulomatous disease. Game over. Our work is done.
Then he's gonna keep getting sick. You gotta call social services.
Bone marrow transplant would reboot his whole immune system. He'll be healthy enough to win miserable Daddy of the Year.
So see if one of his kids is a match.
My kids are already testing his kids.
You tested him? I never consented for
It's
that.
just a blood draw. There's no danger.
To the testing, what about the surgery?
The risk for Will is next to nothing.
What if I don't do it? What are my other options?
Your immune system can't fight off the germs we all come into contact with every day. Now that we know, we can use more targeted medications. But you'll still get sick all the time. You'll be in and out of hospitals.
But I'll live.
Jack, your lifespan will be substantially shortened. And you'll be too sick to care for your brother and sister anymore.
You shouldn't have pressured him into
There's
doing
no pressure.
He's 8 years old. You tell him his brother's dying unless he helps, what do you think he's gonna do?
He wants to help you.
He has no idea. It's like you asked him to let me play with one of his toys. This is surgery. He could die.
He'll be fine. But you're gonna have a hard time protecting him like this if you're dead.
I'll do it. When Will's 18 and can decide for himself.
It's your lucky day. Just found another donor in the registry. Perfect match. We can do the transplant, no danger to the rugrat. Just have to sign here. Unless there's another reason you don't want it.
There's a chance I'd die.
Chance you'll be cured. Maybe you don't want that either. Maybe hanging out in a hospital, getting waited on hand and foot reminds you of what life used to be like before you were forced to play Mr. Mom.
I don't like being sick.
But you don't want to be healthy either. This is your way out. Guilt-free.
I said I'd do it when Will's 18.
He's able to take care of himself without you.
Jack, your brother and sister need you.
I know every second of every day that they need me, but I'm too young to be their dad.
Good for you. Don't pretend you're surprised. How long has your daughter had trouble breathing?
About a week now.
The best dads wait 2 or more.
Yeah, no, it's not like it's serious. I checked online and it's asthma or something.
Or something is the #1 killer of teens with no medical degree. When was the last time he took you to see a doctor?
Like 5 months ago, we went to a clinic in Trenton. I had strep throat.
Remember the antibiotic they gave you? Is it neomycin?
Amoxicillin. So about the inhaler for my asthma, I was...
Sorry. Hospital policy specifically prohibits me from giving meds to unrelated homeless people pretending to be father and daughter. Your pants are a size too short. Either you grew a couple of inches or you grabbed the closest size in a thrift store. And only you have dimples, which are adorable, but they're also an X-linked dominant genetic trait. Which actually doesn't prove anything. The fact that you didn't burst into tears tells me that you never thought he was your dad.
Let's get out of here.
Since you're the brains of the operation, you might want to stick around.
What, so I can get busted by social services?
No, so you can stop bleeding out of your ear. It's usually a sign of a skull fracture. Someone been using your head as a soccer ball?
No.
Much as I'd like to take your word for it, I have no interest in taking your word for it. No tenderness, no pain. Looks like you might actually be telling the truth about something. Ear canal is fine. You don't have a fever. Pay the man. It's late for a trash can fire.
Could you tell me what's going on? What's wrong with me?
I have no idea.
Were you high on that trip?
Not when we were together. I used to wait until you went to bed.
You can stay. If you want.
Okay.
Oh, it's not bad.
What's happening? Is this from the alcohol treatment?
I was wrong. The Barry aneurysm must have just burst. Pressors will only give us a couple hours max.
What causes breathing issues, bleeding issues, paralysis, loss of consciousness? What are we missing?
That's everything bad that's happened. What about the good stuff?
You mean like we should be more optimistic?
She got a little better when we put her on steroids, which can attack tumor cells. Maybe she has cancer.
No hypercalcemia, no elevated blood proteins.
She and her mom mentioned a trip they took to Florida a couple years ago. What about dengue fever? Cholera?
Great ideas if dengue fever or cholera laid in wait for 2 years before suddenly. Did your biological daughter go swimming in Florida? In a lake or a pond or an Everglade?
Yeah, there's a canal near my mother's house. Do you know what's wrong with her?
Family vacations kill. Come with me. I want to explain this twice.
Letting in the flies. She needs to know that.
No, she doesn't. Your daughter has ascariasis. It's a disease caused by a parasitic worm found in feces. Animals use the canal as a potty, and the eggs for the feces end up in Callie's intestine when she went swimming, where they hung out quietly and asymptomatically, biding their time. Till somewhere along the way, they got knocked loose. Maybe dive in volleyball practice, or maybe she slipped on her way into a soup kitchen. But once they hatched, the worms got to work on her lungs, her ear, nerves in her legs. The worms got agitated by the steroids we gave her, which started them on their journey to the esophagus and ultimately to the heart. A few pills of mebendazole, she'll be fine. Margins are fine. No lesions. Color is good. How long have you been having night terrors?
3 weeks. He's afraid to go to bed. He's exhausted, can barely function.
What does that tell you?
Nothing. It's just fun watching him blink. Name as many animals as you can that begin with the letter B. Go.
Baby elephant?
Baby elephant is actually a good answer. B is a bear of a letter.
What does that tell you?
Proves two things. No neurological damage, and your son is never going to be chief fry cook. In teens, there are two likely causes of night terrors. Post-traumatic stress, any recent shootouts at your high school? No. Well then, Dave.
Dan.
If there's no trauma, the other cause is sexual abuse. So who's molesting you? Teacher? Extra friendly neighbor? I'd ask if either of you were involved, but you denied.
No, we would never do anything to hurt Dan.
I say it here, it comes out there. This lack of response is consistent with abuse.
There's no one, okay? I swear. There was trauma. I got hit in the head during a lacrosse game.
Did you know that he got hit in the head?
They didn't mention it, no.
Yeah. Why bother?
No. We took him to the ER after the game. He was scanned. They tested him. He said he was fine. No concussion. It's got to be something else.
You hound me for my opinion, and then you question my diagnosis. Cool. ER obviously screwed up. Kid's got a concussion.
I had double vision before I was hit.
Well, that changes everything. You need glasses. That's why you had double vision, which is why you got hit, which is why you have a concussion, which is why you have night terrors. You need to see an ophthalmologist, which I am not.
You enjoyed that. I brought a reasonable case to your attention and you shoved it in my face just to humiliate
You're an
me.
only child, aren't you?
Why would you say that?
Because everything is about you. This may seem incredibly controversial, but I think sexual abuse is bad. I just wanted to make sure he wasn't being diddled by Daddy or Mommy. Anything else is just a bonus.
I'm not an only child.
Interesting.
What?
Don't move. Did I bore you in there?
What? No, not really.
Are you tired?
Sometimes.
He never sleeps. Of course he's tired.
Right now, at this moment, are you tired?
No.
A twitch in your leg. Did you feel that?
Didn't hurt.
His leg twitched. I don't see what.
It's called a myoclonic jerk. It's very common when you're falling asleep. Respiration rate falls, and the brain sometimes interprets this as the body dying, so it sends a pulse to wake it up.
So?
So, he's not asleep. He's awake. Admit him.
I usually don't move during night terrors.
I'm not restraining you for them. EEG revealed abnormalities in your brain, caused nerve damage in your toes.
What are you doing?
Fixing it.
Can I talk to my parents?
Oh, they know all about this.
I'd really like to see them. Please. I'd really like them here.
This is gonna hurt, Dan.
Oh, God.
Did you see how incredible this call was? A protein deficiency. Can't be tested, can't be seen. I called it based on coughing blood.
You're happy about this?
She's going to die.
That's not my fault. She was gonna die anyway. And now, thanks to me, at least she'll know why.
I'm sure you'll see that gratitude in her eyes when you tell her.
How long?
2 days, maybe less. You have a condition called...
Doesn't matter.
It's a very rare protein deficiency that only manifests...
I don't want to hear it.
Okay. It's what's killing you. This is what's killing you. You're not interested in what's killing you?
Will it make any difference? Will I live any longer?
Please, could you just leave?
What's the point of living without curiosity? Without craving the...
So, I'm screwing up my last few hours because I won't listen to you.
Get out of here. This is like the dark matter in the universe.
You're smiling.
No, I'm not. You can only diagnose a problem by looking at what's missing. You have got leprechauns in ya. Depression manifests in lots of different ways. Some people can't get out of bed all day. Others have serial relationships and become oncologists.
I'm dying. I'm not depressed.
Wrong and wrong. You tried to kill yourself by throwing down kitchen cleanser. Now, most normal suicidal morons would have just drank the stuff, burned the hell out of their mouth and throat. Painful, but not deadly. But being a college-educated suicidal moron, you wrapped it in gel caps or gum, which left no trace, but burned a hole in your intestine. But the body can repair almost anything, which is cool. In your case, scar tissue closed up the hole, but it also formed a bridge between a vein and an artery. Veins are supposed to help the intestine flush bacteria away, but the bridge allowed the bacteria entrance to the artery. where they got a free ride everywhere.
Can you fix me?
Surgery to fix the bridge take about 2 hours. Psychotherapy's gonna take a little longer. Why'd you do it?
I don't know. I've just never been happy. Please don't tell my parents. They'll blame themselves, and it's not their fault. Please, you can't tell them.
Technically, all you have to do is promise me that you won't do it again. And legally, I can't tell them.
I promise.
Yeah, sure.
I can't believe I have cancer.
We caught it early. You should be okay.
I could die. I never went anywhere, did anything. If my father had lived, everything would have been different.
Your mom and stepdad love you. They've given you a great home. That counts for a lot.
He's crashing. Everything's shutting down.
House.
Hello?
What the hell are you doing here?
I was told this might be my last chance to see my son.
You had no right. This is none of your business.
I called him. This man's Ben's hero. Let him spend 5 minutes together.
No, get out of here.
Wait. You sexually molested your son. Your walk, TV's for solace. You have late-stage syphilis, which you gave to our patient, presumably 12 years ago, which also explains why Mom is not big on family reunions.
I shouldn't be here.
We tested him for syphilis. He was negative.
After 12 years, the active infection would have died down everywhere except the arteries in his brain where it could hide out from our tests. When that 6-year-old heckler punched him in his juggling pins, kicked up the dormant bacteria in his pelvis. The immunosuppressants we gave him sent it into overdrive. The antibiotics we gave him actually started destroying the syphilis. But like pouring water on a fire, it led to a trail of toxic smoke and ash. Made his immune system overcompensate. Severe Jarisch-Herxheimer reaction.
Is this true?
Yes, Jarisch-Herxheimer is real. It sounds silly, but... Oh, you mean the right.
I found stains on his clothes. He didn't understand. And he didn't seem traumatized. I kept trying to talk to him, but before long he'd forgotten, and he seemed happy and he seemed normal.
So you made Daddy go away and you made sure Junior had no reason to go looking.
I was just trying to protect him. Like I should have done from the start.
Penicillin and anti-TNF antibodies will be fine. Apart from the whole daddy rape thing.